Cut. See, I even cut a little bit. You can easily just cut right to the abdomen, inside. You can expose the intestine because this muscle really thin. So that's about it. So I cut this here. I already cut a little bit. So this is the external, and then this is the internal oblique. And I also want to show right under this internal oblique, there's a transverse oblique. Obviously, transverse should be the layer, should be this one, right? The fascicle. So this one I probably want to show you here. I don't want to have to do again. Basically, you just cut like I did the other day. The cut the window face, little window. You can expose the layer under it. So you do the same thing, but this time you need to use really thin. What's that? Scalpel. Now, this is the only time you will use scalpel today. Actually, they're really you have to cut just like a paper thin. So, see, I already cut. I started with a release. You really cut really thin. Just cut it here. Then you start to cut a little bit. Then to peel them up, and little bit. So see this. And this is the internal, this is a transverse oblique. So this is transverse this way. So that's the other layer of this muscle. Then this is internal oblique, transverse oblique. So you will do the same thing, on this side. And so I will just cut. So a window size, do the same thing, you peel them up, then you expose. So that's all. So they have 3 layers. Another important, I want to show you. Here you have this is a rectus abdominis. This is a 6-pack, but in the cat there's not big pack. So here's I can show here probably easy. Again, this is the rib here. See, this is 6-pack here at the near this rib area. This abdominis rectus attached to the external oblique. So you have to separate it by lift them up, get rid of this. See, and this section here you can use your hand separate. Using hand is better. So this is the rectus abdominis, and you separate from the external oblique here. And when you go down, see this muscle tend to attach to the internal oblique, So then you have to separate from this here. Sometimes you can cut a little bit, but when you're sure this is just a fascia, you can cut. Be sure. So try not to use that. Use scissors probably better. So this you can peel them out.
So could you just name the layers again?
External oblique, right? This is external oblique. Oblique means that they're this side, right? They have angle, the string. Then see this string like going this side, this like pocket. And this is external. Then internal will go up. The string will a little bit like, see the muscle a little bit up here. This one.
So that's internal.
Internal. Then right now I'm trying to peel in this rectus straight up. Rectus means straight, right? Rectus abdominis, and peel them up. Is on top is close, attached to this external, but on the bottom here they attach the internal. And under the internal one there's a transversus oblique right here. Okay, so that's only 4 muscles, right? 3 oblique, then you have to remember this is a rectus abdominis. So which you can do. Actually, this rectus can go all the way up to the chest area. So we're going to see right now. So you have seen them. And this is ribbon, like a ribbons here. So sometimes you could see the lines like six-pack there, but I don't think cat has really good six-pack there. So you get a abdominal, right? This area. Then next one, I want to show you the neck, superficial. So you only need to remember 5 muscles here. I already dissected. I'm not going to do to save you time, so you can start doing dissection after. You need the skin pretty tightly here. I want you to expose them really good, and go all the way to the gel, on the side. And this is the masseters. It's round, like little shiny. So it's a masseter. This one, and you use really eat, all the leave the gel, and that's mastication. That's the one, right? Then you probably, since I did already a lot of dissection, now it's very clear. You may need a little bit of work to dig in, just so like this side is still mess. So you need to really clean this. You can easily cut the skin. There's some lymph nodes, some gland there. You don't have to care. So you can cut them. Then you can roughly expose right next to this. You can see a muscle really clear here, right? So there's a one here, and the other side there's a similar one, symmetric, right here. So this is like a V shape. One here, one right here. You can see. Probably can see the shape here, right here. So this is a gastric. You need to remember masseters, gastric, then between this mandible to this hyaloid bone here, this is a myohyaloid right here. This is a muscle. So myohyaloid. So 1, 2, 3, right? Then this next muscle is between the hyaloid bone and the sternum. That's called a sternochyloid. Sternum, that's right here, right? You can see trachea right behind. So that's right in the front, and from the sternum to the hyaloid bone. So this is a sternochyloid, okay? And the next one muscle you need to remember to do is separate. This, since they use the neck to inject the drug, so there's sometimes it's already messed up a little bit. So this is kind of muscle already messed up a little bit. You clean them out. You can do the same thing, clean that. It's just along this jugular vein here. So if you clean this one, this is a sternomastoid, and it's sternum right here, right? All the way connect to the, the sternal, the mastoid process of temporal bone. So that's one. So there's 5 muscles here. So now you can go do your dissection, okay? Trying to find this thing. Then next one we will show you.